Hello everyone, this week I wanted to talk about flat-faced dogs and cats or bracycephalics, and in the process I want to embarrass myself a little bit as well. I'm going to try and do some impressions. So bracycephalic dogs, bracycephalic cats, essentially I'm talking about those animals that have got really quite a shortened nose. So when you look from the side, it looks like the long wolf nose has been squashed back towards their head. And the common dogs that we think of are bulldogs, pugs, French bulldogs, those sort of things. And we're seeing more and more of these breeds, and they're very cute, very nice, but some of them do have some problems. In various other videos I've talked about the problems of bracycephalics have with getting too hot and things like that, and that all comes about because essentially all that tissue that should be in that long wolf type nose tends to be compressed backwards, so it comes back into the head and it gets deformed. And there are some dogs which as a result can't breathe very well, and generally there are sort of, I suppose, three main reasons why they can't breathe properly. We look at the larynx, the problems that they have in their larynx. We look at problems that they have in the soft palate, and the soft palate is that soft bit at the back of your mouth at the top, just behind your hard palate, with the long dangly bit coming from it, the uvula, which dogs don't tend to have, and from narrowed nostrils, the nares up here. So as a result of having this, being unable to breathe properly, some of these dogs have chronic lifelong issues that we don't always appreciate, because if you live with something, perhaps you don't appreciate the issues that the animals are having as much as somebody who perhaps takes them on for the first time. And commonly, you know, these dogs come in and they can look really sleepy, and a lot of people say, oh, you know, aren't they cute, aren't they lazy? It could be because their sleeping is getting interrupted by being unable to breathe properly. So think about people, you know, who snore at night and snore so badly that they wake themselves up. So if we go through each one of these problems in turn, and then we'll look at perhaps what we can do to help that. So with regards to the soft palate, this long piece of tissue that extends from the roof of the mouth backwards, that can essentially overlap the top of the epiglottis and the larynx. So the top of the air pipe here, it can essentially occlude that. And you get a kind of a kind of noise as a result. So that's my soft palate. I've kind of pushed it back and I've put it over the back of the epiglottis and over my larynx. Now that noise, I can actually feel it here in my larynx. There's a lot of vibration. In actual fact, I can already feel it. It's quite sore on my soft palate. As a result, that soft palate will become inflamed. As the soft palate becomes inflamed, it actually occludes the airway even more. So we go from to a kind of a noise. And commonly see this in bulldogs. What has always been suggested in the past is to essentially trim that soft palate back. So we go from tonsil to tonsil, we go across and we take the back of that soft palate out. What we forget though is that the soft palate, rather than just being a nice long sheet of tissue, can get quite thickened, and it can come up to sort of 3/4 of an inch thickened. So, you know, it can be that thick, and at the back of a little dog's mouth, that can be really quite significant. So, you know, the back of Frenchies or Boston Terriers or anything like that, you know, that can really cause quite a significant occlusion. So it's worthwhile talking about doing folding flap staplectomies, which is essentially where you cut a big hole in the soft palate, so not full thickness, so essentially you kind of dish it out, and then you get the tip of it and you fold it forward and stitch it just behind the back of the hard palate, and you go from to, because it's all out of the way. The next thing that we commonly find is everted saccules, which are little bits of tissue which just sit behind the vocal cords, and in general we would advise those to be removed. And there has been a little bit of controversy in the past whether they should be removed or not, but the thinking is now we should take them out. But also what we can see is collapsing of the cartilages as well, the cuneiform, the cornuate processes just inside the larynx here, which causes the larynx to essentially, on the in-breath, collapse in. And that kind of sounds more like a so slightly higher pitched noise, so from soft palate, excuse me, so slightly higher pitched noise. The problem with the collapsing larynx is that, again, the more these animals struggle to breathe, essentially the smaller the hole becomes that they're trying to breathe through. And that's all to do with Bernoulli's principle. Essentially, as the hole gets smaller, the air that's shifting through it has to move faster and faster. As the air that's shifting through it faster and faster, that creates a negative pressure, and that sucks tissues in to the hole, closes it even more. And so it can almost obstruct sometimes. So it can be really quite dangerous, and it's sort of a positive feedback thing. They get into this vicious circle where inflammation causes inflammation, and they can get really quite poorly quite quickly. What can we do about that? Well, we can look into what's called tiebacks. So where essentially we pin those, we put little sutures through and hold the vocal cords open. The danger with that is that we end up with food dropping down into the airway and causing what's called an aspiration pneumonia. The other thing that we can do is some of these dogs need to have a tracheostomy, so a hole put into their windpipe underneath their larynx to allow the air to come in. And some of those dogs that may be permanent. Major problem with tracheostomies is that they tend to close up over time, so it's something that we really want to avoid if we possibly can. Those dogs that have had that surgery might not have needed that surgery though if they'd have treated it earlier. So if we'd have stopped the vicious cycle before it got to the point where we're looking at tiebacks, we may have ended up with a much healthier larynx for longer. The next thing that we see is narrowed nasal passages, nares here. So you can kind of go from to a and they kind of vibrate around. Dogs tend not to breathe through their mouth unless they're having problems with their nose or that they're hot. So that can be a lifelong thing. And what we tend to do there is we tend to take wedges out of the corner of the nose to prop the nostrils open, hold them out of the way of obstructing the airflow. Sometimes as well, inside the nose, it's not just an empty cavity. You do have these rolls of bone covered with tissue back there, the nasal conchae. And they can sometimes be, because they're all compressed and shoved back in the nose as well, they can sometimes cause obstructions. In that case, you might look at sort of laser surgery or something to try and reduce that problem. So when we talk about brachycephalics, not every dog needs to have the same procedures. It's really, really important to identify what part of the sort of the breathing system is affected, and then treat that part. There may be more than one part, it might be 2 parts, 3 parts, but just because your sister's Frenchie had a problem and they had this, it may be that your Frenchie has, sounds the same, although the sounds are slightly different, but it might be a slightly different issue that's causing problems. And what I would urge is essentially, get it treated early. Don't just be satisfied with how they are, because they may just about be able to cope at rest, but with any kind of heat, it might be a problem. And in fact, we do recommend sort of a dynamic assessment of what the airway is doing. So, take a video of your dog and then take them out for a walk or a trot, for sort of 10 minutes, get them a little bit out of breath, get the air moving backwards and forwards, then see what it sounds like, see what it looks like. and there is a bracycephalic sort of scoring scale that we go on, and if you're ever interested, just Google Cambridge bracycephalic scoring scale, and you can pick those signs and symptoms out both at rest and after exercise, and from that it will tell you what score your dog's at and whether they need any treatment for it. So yeah, so bracycephalics, very cute, can have problems with breathing like that, and hopefully this video you'll be able to get a better idea of what's going on down the back of the throat there. And if you do need any help, it's always really good to get a video of these dogs, the nose, the breathing, look at their chest, bring that in with you when you go to see your vet. Okay, bye now.